Hello friends, welcome to today's class. It is a commonly known fact that we human beings cannot be healthy, fit and fine all our lives. There are many occasions in our lives when we fall ill. Now let us go back to some of those instances when you or me fell ill. How did we know that we were ill? Well, if you think about it, you will realize that you experienced some kind of symptoms, some kind of deviation from your normal functioning that told you that yes, something is wrong with me and yes, I am ill. Thus, we know that symptoms are crucial and beginning points in the experience of illness, and moreover, they are decisive elements in the seeking of health care. Let us try to define symptoms. Symptoms are defined as a subjective phenomenon or a manifestation of the presence of illness or disease. Thus, there are two major aspects we can see in the definition of symptoms. The first is that it is an individual and subjective experience. It is your appraisal of the deviation that you perceive in your body. Secondly, it indicates the presence of some kind of illness, and at times this illness may amount to disease. According to Radley in his research in 1994, symptoms are not merely signs or labels of inner physiological functioning. In fact, they are special signs because they have a special meaning attached to them, and this meaning is put forward by individuals who appraise deviations in their bodily functioning, and their meaning which they attach differs on the basis of their knowledge, their past experiences, as also on how the medical diagnosis of the symptom is. Thus, we know that the awareness of the presence of the symptom as also the perception of the symptom and how it is understood differs from one individual to the other. So, it is but natural that people will respond differently to the presence of symptoms. We know that symptoms of any illness or disease consist of either physiological symptoms that are related to our physical body or psychological symptoms or both. And these symptoms may either occur prior to the disease onset, during the progress of the disease, that is after diagnosis, or even after the disease has relatively gone down. What we are primarily going to do in today's class is to discuss the various physiological and psychological symptoms of disease and illness. First, let us deal with the physiological symptoms of disease. There can be a wide variety and nature of physiological symptoms that indicate the presence of illness or disease. And these symptoms vary according to the nature of the illness or disease, the severity of the illness in the individual, for instance, what stage of disease he is in, as also the individual's body makeup, whether he is very strong or he is already weak and sickly. Further, these physiological symptoms may either be direct representations of physiological illness, or they can even be indirect representations of underlying psychological disorders. Let us go over certain commonly noticed physiological symptoms when you are ill or when I am ill. The first is changes in general appearance. When we are ill, there are a lot of changes in our overall or general appearance. For instance, there are changes in our face, in our expression, in our movements, in what we say and in the manner in which we say it. What is most important is that these changes are starkly contrastive to our usual selves. That is, during illness, our overall appearance goes in for a lot of adverse effects. The second change that is noticed is in our face. The face is in fact an index for all that we feel, both physiologically and psychologically. In many instances, the face may become swollen and puffy during illness, or it may look flushed, or it may look very pale. Further, it may look either overly alert and anxious, or it may look dull, dreary, drawn and haggardous. A third area where physiological symptoms of disease tend to manifest itself is the eyes. When a person is ill, the eyes may appear heavy and dull, or they may appear unusually bright, inflamed and bloodshot, and especially sensitive to light. The sclera or the white portion of the eyes may show a yellowish tinge, and in diseases characterized by visual disturbances, the person may complain of spots either moving or stationary in front of the eyes. He may complain of halos around lights or a lack of visual clarity and double vision, especially the case in patients suffering from migraine headaches. A third area of physiological symptom manifestation is the nose and the throat. And this is especially in the cases of diseases that revolve around the nasal and throat functioning. For instance, common colds, coughs, sore throats, influenza, poliomyelitis or polio as we know it, pneumonia, sinusitis, and other diseases that are related to the nose and the throat. For instance, the symptoms may include a running nose, cough, cold, hoarseness and difficulty in breathing, a raw and swollen throat, abscess in the tonsils which leads to difficulty in swallowing, hoarseness in speech, and in many severe cases there may also be yellowish or greyish spots on the throat tissues as also bleeding. What must be noted is that symptoms involving the throat, especially difficulty in breathing and chronic cough, need to be taken seriously and need immediate medical attention. Another area of symptom manifestation is the mouth. During illness, the gums may become unhealthy, swollen, sensitive, and may even bleed. Further, there may be the occurrence of oral ulcers, both on the tongue, the jaws, and the walls of the mouth. The tongue may become dry and cracked, and there may be a thick yellow or white sheet that appears on it. Or at times, the tongue may become very raw and may look as if it is bloodied. Further, the sense of taste becomes very diminished, and also the tongue trembles when you ask the person to extend it. Another area is the voice. The person's voice either becomes very weak or very hoarse. This may be either because he doesn't have the energy to speak properly due to the illness, or probably the illness centers around his throat and so his voice is extremely weak and diminished. Another important area where symptoms of illness manifest themselves are the skin. This may include discoloration, patches, itches, rashes, and eruptions on the skin. That is, the skin breaks in many areas and there may even be bleeding. Further, there may also be puffiness under the eyes, on the wrists, or on the ankles. What we must remember whenever we see symptoms related to the skin is that the skin is like a covering which covers our entire body, and any kind of break or eruption on the skin gives bacteria an opportunity to infest the body. We may already have experienced that whenever we have any kind of illness, we generally have a severe loss of appetite. We do not feel like eating anything because primarily we do not have any sense of taste left. Everything that we eat tastes the same, and moreover it tastes bland. Loss of appetite, although, is one form of symptom manifestation. Another form involves an excessive increase in appetite, an unnatural increase in appetite, especially for certain kinds of food. We must also have seen this phenomenon, especially among children, that they have a liking for certain kinds of unusual things which we generally don't include as foodstuffs. For instance, chalk, grass, paint, plaster, and even dirt. This may in fact be a representation of some kind of deficiency in the body, or sometimes it is a manifestation of emotional disturbance as well. Another area of symptom manifestation is your weight. Unusual gain or loss of weight in the absence of any kind of dieting or excessive intake of food reflects that you have some form of illness. For instance, cancer involves an unusual loss of weight even when the individual is not dieting. Similarly, hormonal problems such as thyroid imbalance results in increasing fluctuations of weight, either an excessive increase in weight or an increasing loss of weight. Now we come to an important factor, something which is most important for our survival and well-being: sleep. And you will know that illness disturbs this facet as well. Illness is often accompanied by insomnia or the lack of sleep, or hypersomnia, that is excessive sleep. And most importantly, it also involves disturbances in your sleep patterns. Apart from the fact that other physical illnesses may disturb sleep, sleep in itself comprises of certain sleep disorders. Let us have a brief look at it. One is the sleep terror disorder, which usually occurs among children, and they have terrible nightmares which are often accompanied by emotional and facial changes which may at times scare the parents. But when the children wake up, they do not remember anything of it. Another is sleepwalking or somnambulism, where the individual walks and does in fact complicated tasks when asleep which he cannot even accomplish during normal daytime activities. However, this may be risky because the individual may in fact take up risks and risky activities while sleepwalking. Another sleep disorder that we are going to discuss is sleep apnea, which is an extremely critical condition. As soon as the individual falls asleep, he stops breathing. And because he stops breathing and due to the lack of oxygen, he wakes up again. In fact, this waking up is extremely critical because if he fails to wake up, he may die when in sleep. Another and the last sleep disorder that we are going to study today is that of sleep paralysis. Just while going to sleep or just before waking up, the person experiences a total paralysis for some time. He is aware of all that is happening, but he cannot move his limbs or his hands in any way, and this can be extremely terrorizing and traumatic for the individual. Also, any kind of illness or disease involves a general malaise or a general feeling of lethargy, weakness, fatigue and exhaustion. This may be accompanied by fever as also body pains and headache. This may either be before the illness actually has its onset or even during the illness, and many times during the period of convalescence or while the individual is recovering from an extremely serious illness. We will now come to another facet of symptom manifestation, the pulse rate and the respiration rate. The pulse rate and the respiration rates of individuals normally vary according to different facets of their life. For instance, age, sexual activity and other factors such as increased activity, increased exercise or dealing with a stressful situation. Pulse rates that are unusually high or unusually low, even when we take into consideration that such factors such as age, sexual activity and stressful experiences may exist, in spite of that, pulse rates which are unusually high or low are generally found to be serious symptom manifestations of underlying illness. For instance, pulse rates in cardiac patients generally tends to be unusually high, that is tachycardia, or it tends to be unusually low, and it is generally accompanied by low blood pressure. Further, unusually fast respiration rates or painful breathing generally accompany diseases such as asthma and can be an important indication that the person is suffering from illness. Now we come to a very important symptom manifestation, pain. Pain, in fact, though we really do not like pain in any way, is important for our survival, because unless we experience pain, we do not know that we are in danger. It is this pain that tells the individual that yes, something is wrong with my body and I need to seek medical help. The nature of the pain, the severity of the pain, the location of the pain and the individual's past experiences regarding pain can play important role in how this pain as a symptom is perceived and understood. Often when we are ill, especially due to abdominal discomfort, we undergo nausea and vomiting. Nausea and vomiting accompanied by severe cramps, abdominal pain and ulcerations can be an indication of a wide variety of diseases. For instance, a normal diarrhea or appendicitis or peptic ulcerations. What is important is we analyze the nature of the event that possibly triggered this bout of vomiting, the volume of vomit, the content in the vomit in case there is blood in vomit, or the color of the vomit, and other factors associated with vomiting such as feelings of continued nausea or headache can be important in helping us decide what is the underlying factor causing this nausea and vomiting. Another area we need to focus is bowel movements. Frequent diarrhea, even when the person is not taking laxatives, can be a sure shot sign of some kind of abdominal discomfort. The number and frequency of bowel movements, what you think might have caused this, that is the possible triggers for the same, the color and consistency of the excretion, and other related factors such as the presence of blood in the excreta can be important pointers on what kind of illness underlies this symptom. Another area that we need to focus on is urinary disturbances. Urinary disturbances including excessive urination or the inability to urinate due to pain or burning sensation when voiding, incontinence or the inability to control urine, the presence of blood in the urine, the color of the urine as also the extent of sedimentation present are important factors that can determine the underlying illnesses causing these kind of symptoms. Now that we have an idea of what physiological symptoms of illness comprise, we'll go over to the psychological symptoms of illness. Just like physical symptoms of illness, psychological symptoms of illness may either be a direct expression of underlying psychological distress or mental disorders, or can be an indirect expression of physical distress. Psychological symptoms of illness may include depression, sadness, anxiety, aggressiveness, inability to concentrate, irritability, and mood swings. For instance, in patients suffering from bipolar mood disorders, they experience alternating states of mania and depression. During states of mania, they become excessively happy and overly ambitious and often develop a number of unrealistically positive plans. However, during phases of depression, they become completely withdrawn both socially and emotionally. Further, during some kind of psychological or physiological illness, the person may lose interest in activities that he normally enjoyed, either because he no longer has the energy to continue those activities or because he no longer has the motivation to engage in those tasks. This may be accompanied by other psychological symptoms such as a poor work performance, poor feelings of self-worth, feelings of helplessness and being dominated by situational circumstances, an engagement in self-harming behavior such as cutting oneself or engaging in risky practices such as sexual risk behavior, substance abuse, drug abuse, and excessively fast driving. Further, the person may also experience a loss of appetite, excessive lethargy, and may also have confused thinking and hallucinations, which is an important criteria in psychological disorders such as schizophrenia, as also a denial of the reality of the situation, a refusal to accept the reality, as also suicidal ideation and thoughts. Now that we have discussed both the physiological and psychological symptoms of illness in some detail, we'll come to certain conclusions or premises that we can draw from what we have learnt. The first is that the same physiological or psychological symptoms may be indicative either of a physical disease or illness or of some kind of psychological disorder. For instance, hallucinations and confused thinking are the primary symptom of major psychological disorders such as schizophrenia. However, this same confusion or hallucinations can also be associated to delirium, associated with severe fevers or some kind of serious illnesses which do not have any kind of psychological correlations. Similarly, a loss of appetite may even be due to some kind of abdominal discomfort or diarrhea. At the same time, a loss of appetite can also be due to feelings of depression and feelings of having an extremely low mood. The second premise is that the physical and psychological symptoms of illness are closely intertwined at various stages of illness and they act as causal factors for each other. For instance, a person who is having brain tumor will experience a lot of headache, discomfort and difficulty in concentration. As a result, his work performance may suffer consistently. This consistent underperformance can lead to psychological correlates such as depression, irritability and anxiety. This in turn will serve to increase the symptoms of brain tumor and the discomfort that he already has. Further, if the diagnosis of brain tumor indicates that it is a severe condition, he may consequently have greater feelings of depression, anxiety and anger, which in turn will not only reflect on his work performance, but also have an adverse effect on the compliance to medical treatments. Similarly, Ill health, such as chronic feelings of anxiety and depression, may trigger physiological symptoms such as oral ulcers, headaches, and abdominal discomfort. Now we shall briefly go over some of the factors that influence our perception of symptoms. For instance, the degree of body awareness that we possess, or the degree to which we are aware of the various physiological changes in our bodily systems. People who are well aware of this are more likely to perceive symptoms sooner. Secondly, another factor is the degree of importance assigned to health-related factors. While some people are very conscious about their health, others tend to neglect a number of health-related advice and factors, and hence they are less likely to perceive the symptoms, and they are also less likely to recognize and seek help for them. Other factors include personality factors such as neuroticism and pessimism. Neurotics are generally anxious and apprehensive people, and pessimistic people are people who generally see the negative side of things. Hence, they are more likely to report more symptoms and see symptoms as more harmful and threatening. The salience of the situation or the context in which the symptoms occur, and each individual's unique threshold of pain can also have important impact on how the symptom is perceived. For instance, some people are capable of suffering a large amount of pain and discomfort, and hence they may view the symptoms as producing relatively less uneasiness. On the other hand, people who have a low threshold of pain tend to perceive even minor symptoms as extremely troubling. The individual's childhood learning experiences from his family environment, from his socio-cultural background and ethnicity also play an important role in how he perceives the symptom and how he reports and seeks help for it. Also, cognitive factors such as knowledge regarding the symptom, knowledge regarding health beliefs and health practices can play an important role in how an individual sees a symptom and how he seeks help. Other factors include age, gender, socioeconomic status, as well as the characteristics of the symptom. How serious does the symptom seem to the person? Also, fear and stress associated with medical procedures and evaluations can also be an important impediment coming in the way of people seeking help. To conclude, we have learned a number of things in today's chapter. Let us have a brief overview. First, we learned that symptoms are extremely crucial, the beginning point of illness and the basic decisive factor that prompts us to seek help. Secondly, we went over a number of physiological symptoms related to different parts of our behavior, different parts of our bodily functioning and systems. We also understood a number of psychological symptoms that we may exhibit. Further, we understood two important things: that physiological and psychological symptoms are closely interrelated and that they may cause each other. Also, we understood that the same physiological or psychological symptoms can be related to either physiological diseases or psychological disorders. Finally, we understood that there are a number of factors which determine how we perceive symptoms. These may include our own physical factors, our own psychological factors such as personality variables, and the socio-cultural context that we exist in. What we must take back from today's class is that an awareness of symptoms, not just an awareness, but a timely awareness of symptoms, a recognition that symptoms can be important indicators of underlying illnesses, and the habit of seeking medical help, that is standard medical care, in a timely manner can be an important and decisive factor that determines both your survival rates as well as your physical and psychological well-being throughout your life.